Good afternoon and welcome to the Moscow Urban Forum. This is the keynote track and my name is Ksenia Adjube. I'm director of Adjube Scott Whitby Architects, and it's my pleasure to host today Stefano Capologno with the talk COVID-19 and Cities, from Urban Health Strategies to the Pandemic. It's a great pleasure and honor to have Stefano with us at the forum today. He is an architect and professor in hospital design and urban health at the Polytechnical di Milano in Italy, director of the Department of Architecture, Built Environment and Construction and Engineering at the Polytechnical di Milano, as well as the mastermind and director of many courses in healthcare facilities design, in therapeutic landscape design, residential courses related to the relationship between the built environment and health, at universities in Italy, France, and worldwide. Stefano is also the president of the Urban Public Health section of the European Public Health Association, coordinator of the European chapter of the International Academy for Design and Health, and the general secretariat of the Italian Center for Hospital Building and Design. He also coordinates the research group Hygiene of the Built Environment for the Italian Society of Hygiene and Preventative Medicine. And he is a member of the working table Urban Health at the General Directorate of Health Prevention of the Italian Ministry of Health. So it is a great honor to have Stefano joining us today for this highly relevant topic. And we look forward to seeing your presentation. Stefano, the floor is yours.
Okay, thank you very much, Ksenia. Good afternoon to everybody, and thank you very much for inviting me at this fourth International Medical Investment Forum. So, and my presentation, this is the first step of my presentation, is the theoretical background in urban health. And so in my presentation will be an overview about the urban health challenge according to healthy lifestyle promotion and COVID-19 needs. So I think architecture is a generator of health, well-being and healthy lifestyle because for main issues. The first is a growing urbanization phenomenon, public health concept moving from a medical approach to a social approach, and urban health issues, urban health topics needs assessment tool and performance approaches, and healthy experience-based design strategies as primary public health prevention policies. So today is well known that the determinants of health depends 50% for social economic factors and lifestyle, 20% environmental condition, 20% for genetic inheritance, and 10% healthcare services. For the social economic factors and lifestyle, environmental condition and healthcare service, architecture and urban planners have a key role, important responsibility. In this slide, you can see that the major part of non-communicable disease depend from urbanization. The first step of the main chronic disease in the Europe region start with the social economic, cultural, political and environmental determinant. And we know non-communicable disease represent the 80-60% of the death and 70-70% of the disease in charge of European region. We know the sedentary is the fourth reason of the death in the Europe region. So according to the healthy urban planning and design strategies and action, here you can see the result of a literary review that join together the principal environmental risk factor, for example, the possible health outcome main related to the non-communicable disease, and the urban health strategies to improve and promote the public health. For example, green and blue area, biodiversity, or public transport, or social and functional mix, urban solid waste management, outdoor space, lighting. We have to define 20 urban health action with this important literary review. So the first action is the green infrastructures. In this image, you know, a very famous part in New York, in Manhattan, is the Central Park. It's a very big park in New York. And this part is very important for the urban health because we have the big responsibility of the green for the health of the population. And in this period for the pandemic, the urban park have a key role for the resilience of the city. But in the literary review, we know the green is a very important therapeutic element. We have the important study of Ulrich, where is demonstrated the importance of the green for the health, not only to use the green, but it's important, for example, for the perception green and for the mental health. Because I want to remember the health is not only a physical problem, but is a social and in the same time is completely well-being in the mental health approach. So, for example, the green infrastructure, we know is important to have a big area and for the big effect of the health. And another important example, I don't have the image, but probably you know the important project in Paris, for example, in Promenade Plantée, or in the same city in New York. It's very important for one important new example is the height line, where the main topics representative is the green area. And the green is very, very, very important. We have different green. We have the private green. We have the public green. Is not different. We have the green line. But today in the city for the public health, I think it's very, very, very important. So the big challenge for the architects, for the designer in general, is to use the tool for demonstrating the effect. Today the big challenge is to understand the architecture, the responsibility, and it's very important to define with the tool the effect of the infrastructure for the health. And for this reason, usually we use the mathematic tool. In particular, the system, the method is multi-criteria analysis, where we go to define the different indicator, and in particular two big category of the indicator. One category is the quantitative indicators. For example, quantitative indicator is possible to measuring the surface of the green area. But in the same time, it's important to use the qualitative indicators. For example, for measuring the view of the building outside. And it's very important, for example, for the mental health approach. So the second action for the urban health is the blue infrastructure. And in the many city is present. We have the presence of the water, and this is a very important element for the life, for the well-being, because is an important resource for example, for control the microclimate in the city. Is important for the security, for example, in the city, and the water is the life element in the city. In the past time, the water represented the line for the transport. Today represents the very important element for the control of the climate in the city. So the third step of the action for the public health is the gray infrastructure, and in particular the gray infrastructure is for example the square in the city. And sorry, I want to remember why it's important to speak in public health, in particular in urban health. Because today I want to remember the 54% of the people live in the city, and we have the provision with the ONU in the 2050. Moreover, 70% of the population live in the city. For this reason, it's important to understand and to study the risk for the population where live in the city. So the third point of the action for urban health is the gray infrastructure, is the public space. This public space is very important, for example, for the physical activity, but in the same time, it's important for the environmental aspect. For example, this example is a photocatalytic pavements floor, and with the specific materials. And in the same time, it's very important this action for the social inclusion of the people, because today the square in the city is very representative for the meeting the people, for discover the activity, for the social inclusion activity. And the social inclusion, I think it's very, very important for the public care. The third action for public health is the biodiversity protection in the city. We have many examples in this direction. One famous example in Milano is not in this image, but probably you know, is the vertical forest in the city center of Milano, designed by Stefano Boeri. And is the typical example where it's important to define the biodiversity in protection. And the other more example in this direction, for example, is the green roof, where is it possible to use the roof of the building, and why is it important for the health the roof to transform the roof of the building green roof. Because today the roof of the building it's representative for to purpose the green area, but in the same time it's important, for example, the orthotherapy or for the green in general. But in the same time, it's very important because is a space where is possible the people live in this building, and is it possible to meet in this space, public, but in the same time private space in the building, where is it possible to create the important aspect of inclusion, social inclusion. So The first topics, the first section is the meteorological water management. And we know that the environmental today it's very important topics. And in particular, we have the aspect, for example, with the water element, the water square. We have the risk, the emergency situation in the many cities in the Europe region for the very strong raining. And for this region, the design action for the meteorological water management is to design the water square and in particular the raining gardens. The raining gardens is the particular gardens where we have the capacity to take water, and we have a specific hydraulic system for the recycle of the water. And the other important aspect in the meteorological water management is the raining gardens. In this image, is it possible to observation? The square, the garden is a play space, but where we have the meteorological critical moment, is it possible to transform this sport area, this play area, in rain garden? We have many different strategies in this direction. So the other important aspect is the underground, is the public transport, and in particular, is it impossible the mix of the different public transport? We have the underground, for example, the bus and the tram. And today the big challenge, I think, is to introduce and to create the mix of the different public transport in the city. And we have today the new other alternative of the public transport, for example, the bike or the car sharing is another big opportunity for the urban health in the city. In these topics, we have one very important study in this direction for reduction of the vehicular traffic, and is a Barcelona study. And the name of this model is Superblock in Barcelona. We know Barcelona is a very important city in Europe, and we have a big problem of environmental aspect. But at the moment in Barcelona is the principal city, metropolitan city in Europe, where we have the main space dedicated for the pedestrian area. So why is important this model, this approach of Superblock? Because we have to define the road hierarchy model, where we go to compact the grid of the city. The grid of the city is very regular, and we go to define the super block with 9 neighbors, and this form, this super block, we got to put in the middle of the super block the many commercial activity, and at the same time to transform this street in the pedestrian street, and you translate the traffic outside the super block. So inside the super block is a low velocity, is 10 kilometers, and outside the traffic is a normal traffic. This strategy is very important for the public health because to transform this area in pedestrian area, and in the same time to introduce the concept of the resilience in the city. Why the resilience? Because these design strategies to improve the economic aspect, for example, commercial services and the other service in the middle, and to define the small city in the big city. And this is the map of the Barcelona. Is it possible to look at the Barceloneta, the old city, and around of the city? We have the plan designed by Cerdà, and it's very clear the new strategy of Barcelona to transform 120 potential intersection in super block. So, and the eighth strategy is to implementation the pedestrian cycling paths, in particular with the multimodal street design. For example, this example is in London, to transform the normal street in a new design of the street, in particular to go to improvement the pedestrian area, to introduce the specific street for the bike, and to introduce the specific area for the green, to improvement the pedestrian paths, and to improve the public transport, and at the same time to reduce the private transport and the car. And the study in this direction to demonstrate this strategy, this design strategy, to improve the total capacity of the people use this space in the city. The other very, very big important challenge for the public health, and in particular for the urban health, is the social mixity. This example is a very big parking in the periphery area of Copenhagen, and we transform this parking in new parking with the roof where we go to put the playground, and is a very important design action for Copenhagen, because we have the opportunity to introduce a new activity in this area, in the periphery area, and in the same time is important because to improve the physical activity of the population. And this design strategies is, I think, the realistic action for promote the physical activity. I want to remember the World Health Organization to recommend it 30 minutes every day for 5 days in the week. It's very important for the prevention of the health. And with this recommendation of the World Health Organization, I think the city have a key role for these important topics. Today, the big challenge is to transform the city in the area where it's possible to implementation the physical activity. And this example, it's very clear, and it's very I think intelligent solution, because we have the double effect. We implement the physical activity, and in the same time you renew the periphery area of Copenhagen. In this direction, the functional mixité, another good experience, interesting experience, is we have two very interesting experience. One is in Paris, is the 50-minute city, in French is La Ville de Quart d'Heure, is where we go to define a neighbor services plan like the 50 minutes city concept. And this approach is a new approach in many metropolitan cities in Europe and in the world. For example, in Italy, and in particular in Milano, we study this opportunity for transform the part of the city in the 50 minutes city. What's the topics? What's the challenge of the 50 minutes city? Is to have many services near the house, and 50 minutes is a proximity service, and 50 minutes for go and 50 minutes for back at home is exactly the time, the 30 minutes, and the 30 minutes is the time recommendation of World Health Organization for the prevention of the chronic disease, and in particular to reduce the sedentary approach. I want to remember, in the city, the expectancy of the life is too much to hide outside the city. It's too much to hide because in the city you have the capacity to generate the economy aspect. It's too much in the city because the people have the level of your culture is to height, and in the same time the education is height, and in the same time we have the capacity to arrive of the important service for the health, for example the hospital or the social services typical of the city. So,
Stefano, we have 1 minute remaining.
Okay,
so
okay. I go very fast. The other important experience is Glasgow concept, where we go to study the urban plan for the ground floor. We go to define the activity. The other important action is the urban solid waste management, and in particular the pneumatic network is one approach. Is very important the renewable energy and efficiency, and we have many examples in this direction. The outdoor spaces lighting for the safety and the security is very important. And we have to introduce the new topics. The new topic is design for all, in particular the problem of inclusive design and accessibility in the city. So very fast, the last consideration from urban health and the pandemic challenge. In particular, before COVID-19, urban density was considered a positive factor for public health because cities were a place of social, cultural, educational, professional opportunities. So during the first pandemic period of COVID-19, cities like Milano registered lower cases of infection compared to the peripheral area. The possible reason is the economic status, or, for example, the lower daily travel in the north neighbor, or with the other possible reason is possible to read in this diapo. So COVID-19 causes, I think, a rebalancing of the urban economy with an increase in real estate value and social interest in less dense context. Part of the Next Generation Euro program, about 209 billion for Italy, for example, are a unique opportunity to rethink the periphery of our cities, integrating healthy action. COVID-19 accelerated the ongoing process of public health and urban health, stressing the existing emergency, increases the new social and environmental demands, improving digital challenge. With some Italian colleagues in public health, we developed a position paper titled COVID-19 and City and the Color of Public Health Opportunities. The conclusion of the study is a decalogue divided into immediate and medium long-term action capable to promote a COVID-19 proof environment. In particular, I want to underline the last point of the decalogue, the importance of a multidisciplinary approach, and introduce the new professional skill of the healthy city manager. And I conclude my presentation with this diagram that stressing the importance of the bringing together knowledge between designer, policymaker, city user, and public health expert. Okay, thank you very much for the attention.
Stefano, thank you so much. It was such a beautiful and design-oriented presentation with so many relevant examples for Moscow. In particular, I think the rewilding and urban forest idea and active child-friendly spaces. So we hope to welcome you in the flesh soon, and thank you very much. And thank you for listening. Goodbye.
Goodbye. Thank you very much.